Hi, this is Dr. Ryan Green again. We're going to go through our treatment options for treatment of venous insufficiency and varicose veins. So, how do we treat the problem of venous incompetence or venous insufficiency? So, essentially, we need to close the offending source vein using one of several treatment options. We can use laser ablation, we can use adhesive ablation, chemical ablation, or sclerosis, or we can remove the varicose vein with microphlebectomy. And so we'll run through each of those treatment options for you. So first, in a venous laser ablation, we start by accessing the vein under ultrasound guidance in a minimally invasive way by placing a small wire and tube into the vein. We advance the tube up to the region of the junction, and we pull back slightly, about 2 centimeters from the junction. Then we deposit numbing solution around the vein, which also serves to insulate the surrounding tissues from the heat we're about to deposit. We turn on a laser fiber, and then we withdraw the laser fiber slowly. So as we withdraw the laser fiber, as you can see in the right picture there, the vein collapses and it becomes damaged by the heat, and it causes it to close and stay closed. And there on the left is a picture of the laser fiber tip itself. The other thing we can offer is adhesive ablation or venous seal. It's a newer procedure. We essentially do the same thing. We access the vein under ultrasound guidance, and we advance the catheter up, and the similar steps as laser ablation, except instead of heat to close the vein, we can use glue. Another option we have is called ultrasound-guided foam sclerotherapy. So sclerotherapy is another option. We typically use this technique when veins are windy and not amenable to laser or adhesive ablation. So we can use a small butterfly needle to access the vein, and then we inject a foam sclerosant, which chemically damages the vein and causes it to close. And then we have microphlebectomy. So the bulging varicosities that are visible, we can perform microphlebectomy. So it's used as an adjunct to ablation and sclerotherapy to physically remove larger, which when we say large, we mean greater than 3 millimeter veins from the legs. So in this procedure, a local anesthetic solution is administered, and a tiny nick is made in the skin through which a hook is used to tease the vein out and remove it completely. So depending on how many veins you have, this procedure is usually done at the same time as an ablation. Here's an example of a before and after in a patient who had laser ablation and a microphlebectomy. So a very dramatic result. So finally, the smaller reticular and spider veins can be treated typically after we're finished treating the larger veins. And if you don't have larger veins, this can be done alone as a means of treating the smaller veins. So we inject the sclerosant directly into the veins, and this is an example of the procedure. The feeding source vein is injected, and the medicine goes into the branches and damages the vessel wall, so they collapse and begin to fade or disappear. And here you can actually see a pretty dramatic example of access to the vein and injection of the medicine. You'll start to see those veins turn white as the sclerosant forces out the blood. So I hope this was a useful look at the tools in our proverbial toolbox. All of our physicians and technologists are well versed in all of the treatment options that we mentioned. Each of these has their unique risk and benefit, which will be explained in writing before the procedure is performed. So please do not hesitate to ask any questions to your tech or physician during the consultation, or any time for that matter. And once again, thank you for choosing Legacy Vein Clinic.